Okay. Is there a threat to life, limb or sight requiring immediate emergency admission?
Call after call into the London ambulance service.
And what time did he take the drugs?
That's fine.
I'll leave you with them. Okay, well done, my love. Okay, take care.
And yet what they said today was this was nice and steady, the calm, as it were, after the storm. If December was horrendous, figures out today for England's health service show January was better. Improved accident and emergency performance and, as we could see here, better response times for ambulances.
But the average response time across London for this category of call is between 18 to 20 minutes.
It is slightly less manic than yesterday, but it is still an early time of the day. And right about this time you find that we do start getting a pickup of the pace as well.
The industrial action during December and January did mean that the public heeded the plea not to call 999 unless a life was at risk. In some areas, calls fell by more than 30%. But tomorrow we'll see another strike. 15,000 members of Unison in 5 areas in England will walk out.
Tomorrow the strike involves the 999 call handlers, the frontline ambulance paramedics and crew, plus our 111 service, plus all of the support services that back up the front line. And that's everybody. And of course, as the strikes have progressed, the union membership has grown. So I think Unison were very proud that this was the largest NHS branch in the country. Well, they've gained, we think, at least 1,200 members since the beginning of the strike.
So once again, the public are asked only to call when it is a life and limb emergency. There is still no sign of discussions or negotiations between the UK government and the health unions. And what NHS leaders are now saying is that some of those pledges made by the Prime Minister himself to reduce waiting lists, are at risk unless this industrial action can be resolved. Physiotherapists across 33 England trusts are striking today, but they had said the action would be suspended if genuine talks took place. So far this year, there has only been one 45-minute meeting, which was held on the 9th of January. It is now an increasingly different picture throughout the UK. An improved pay offer averaging 7.5% has been made to NHS Scotland health workers. This week, the Welsh Government put an extra 3% on the table and most strike action was suspended. But in England, there is still no offer over and above the 2022-23 pay award of £1,400. And now the Fire Brigades Union across the UK has suspended strike action after an offer of a 7% pay rise, backdated to July last year and then 5% from July this year. A statement said the Health and Social Care Secretary, Steve Barclay, wanted to continue to discuss next year's pay deal, one that was fair and affordable, and he urged the unions to call off the strikes and engage in a constructive dialogue about the pay review body process for the coming year. So far, more than 137,000 appointments have had to be postponed or cancelled over the 2 months of the industrial action, and it comes at the same time as warnings continue over staff shortages and winter pressures.